All right, we're gonna go ahead and start, but can everyone hear and see me?
Yes.
Yep.
All right. Aloha, thank you all for attending today's talk delivered by Dr. Kealoha Fox. It is my honor to introduce Dr. Fox, a Native Hawaiian scientist, practitioner, and community advocate based in Hawaii. Her innovative programs and policies address the health of Native Hawaiians and Pacific Islanders by utilizing a social determinants of health model of care that values culturally effective public health and medical services. She was a public servant leading racial justice policies in the government for 10 years and now leads social health integration at Aloha Care. Dr. Fox is the recipient of more than 50 awards and distinctions, who has published numerous books, articles, and editorials designing health and well-being strategies and measurable outcomes. The Obama Foundation inducted her as an Asia Pacific leader, and she recently accepted an appointment as climate commissioner to the American Academy of Arts and Sciences. As a lifelong Haumana, Dr. Fox has been deeply and purposefully trained by esteemed community elders in traditional and customary Native Hawaiian practices and protocol, such as Hooponopono, Haha, and La'aulapa'au. We are incredibly lucky for this opportunity to hear from Dr. Fox on this area of her expertise. And with that, I will now turn the floor over to Dr. Fox.
Aloha, Velina Maimi, Kealoha Kako. Thank you so much for having me. First, I want to say how impressed I am with your pronunciation of the phonetics. I am blown away right now. You've done such a great job, and it means a lot since oftentimes I do these panels and presentations and have introductions where I'm sure many of you can understand your name gets butchered or the name of your town doesn't sound anything like it's meant to. And so it's really nice to be in a space that already has just a beautiful and welcoming tone. I also just wanted to start by saying for if any of you are in Hawaii, right now we are having a massive storm system. So I have lost power at home. I am at one of my businesses. I am a small business owner, which I can tell you about later. So apologies for not having my normal, really fancy tech and setup, but we're just making do during this rain bomb, which is part of the reason why I do so much work in climate change. I have a brief presentation that I would love to share with you folks. It's the new products that I am launching and creating and managing at Aloha Care for Medicaid members. And it's specifically about how we're articulating culturally responsive health program services and covered benefits for our members, which is really exciting. I haven't presented this very often yet, just because they were recently approved by the government through 2026. So folks maybe haven't seen this work as much. And then I wanted to pull the slides down. I wanted to definitely open it up for question and answers and then have more of an open dialogue. I'm also a professor and a mentor. And so I want to be able to help support you any way that I can along your journey. And if you have questions, please feel free to use the chat. And then later, if you're able to, feel free to turn on your video and unmute yourself and we can have an open dialogue. But if there's no other announcements or starts to today's session, I'll go ahead and begin with this brief PowerPoint presentation, if that's okay. Great, I'm seeing head nods. Let me just see if I can share screen. I think if someone can provide me permission. Great, got it. Okay. Awesome. Okay, so Throughout the past 20 months or so, there have been, two primary job functions that I've had to carry out on behalf of Aloha Care. And this is, really important, I think, as we reflect on one, opportunities and lessons learned during the pandemic, but two, silver linings and ways that the pandemic has also been a useful teaching tool for many of us in the way that we look at the future of health as an industry and the future of health care for those of us that identify as clinicians and practitioners, scientists, and public health advocates. So one of the things that I did actually really early on during the pandemic was I went through a really systematic process to understand who are the people that we're serving and how do we look beyond the typical public health and medical health services that we provide as a managed care organization, and how do we bring much more social care integration that's based off of the beauty and the respect of the local culture in the demographics that we serve. And so at Aloha Care, we serve about 3/4 of our members are identify as BIPOC, and about 33% of our members identify as Native Hawaiians and Pacific Islanders. So because these demographics are so unique, it means that we can't just easily copy and paste programs, services, covered benefits, treatment plans and options to the people that we serve from any other place. It doesn't make sense to just copy and paste something from Florida or Texas or Michigan and expect it to work here with a high degree of quality and also a high degree of uptake for the population. And that's especially important because my work does primarily focus on Medicaid and Medicare beneficiaries. So in this work, it's actually a part of a cohort with ACAP, the Association for Community Affiliated Plans. And so there was about 22 managed care plans that were a part of the cohort that I was in. And it was really about how can your organization respond to the social determinants of health and operationalize those actions within your MCO, not just for 1 year, but for multiple years. And so what I was able to do was create a domain-based plan. And so you'll see the various domains here with healthcare system alignment, food and natural environment, community and cultural strengthening, economic stability, women, infants and children, education and digital technology, neighborhood and built environment, and an entire pillar of intersectionality. This has been really important because it serves as the roadmap of us understanding and organizing the needs of the members, and also understanding and organizing the ways in which we can meet and deliver on their needs. And so oftentimes you might hear, that your patient needs stable housing, or they need legal support services, right? All of this is part of these structural determinants of health, right? The housing system, the housing market is one huge monolithic area. But if we go into the neighborhood and built environment as a structural domain of health, there's all types of SDOH indicators, right? There's shelter-based services. There's services that help patients who can't afford their utilities, so on and so forth, right? And so this has been a great way for us to organize our work and then plan for action through 2026. And at the primacy of this plan is we want to do two things. We want to promote better health of our members, and we know the social integration of their care is critical to that. We've learned that, especially through COVID, and that we should be aiming towards health equity as the goal, right? The goal anymore is to not have just our patients go to their well check visit once a year. those are not the goal targets anymore. COVID has taught us so much about these structural determinants of health that we know that we have to prioritize and think about those investments much more. And so we're starting with the food and natural environment, women, infants, and children in the neighborhood and built environment, because that's what the data has shown us. We did do interviews with our board members, we did a survey with our staff, and then I did an intense amount of quantitative analysis on our member data. And so we have this great roadmap of where we're going. With that, it's allowed me to have the data and the information necessary in order to launch new value-added services as covered benefits for Aloha Care's members. And this is really important because in the communities that I serve, especially Native Hawaiians and Pacific Islanders, it's described as, one auntie told me, that the people that we work with, the people that we work for, do not currently have extra money to be able to spend on what we would see as their own health, wellness, and well-being. So what's one auntie that I work with in a Native Hawaiian community said in some of her research that she's conducted, people do not even have $25 to spend on their own health promotion. And so this has been a great awakening for Aloha Care, because we know that these programs then need to be offered free of cost with no copay and no out-of-pocket expenses for the people that we serve. And so this is inclusive of our adult basic dental. So Medicaid does not cover adult basic dental. Having great dental care and integrating oral health care into someone's whole person wellness has been essential to us not separating our mouth from the rest of our bodies. And then I'm really excited to share with you kind of for the first time that I've been messaging it over the past month or two are the 5 new services that I've developed. So the first one that will kind of go over is this new education program. And so I used to actually work in education. I worked at Kamehameha schools. I worked for the Hawaii Department of Education. And then I used to be a provider for behavioral health to families whose children were on the autism spectrum. So we did a lot of family-based therapy and family-based behavioral support for those patients that I saw. And so what I was able to do was look at the current population statistics in Hawaii for eligible adults over the age of 18 who didn't have a high school diploma. And it's actually a lot. It's about 13% of Hawaii's population doesn't have a GED or high school diploma. And so we were able to work with the Hawaii DOE and their adult education division, and we've created the first covered benefit where our members over the age of 18 without a GED or high school diploma will be able to partake in these adult education services. They'll have an education coordinator assigned to them. They will have a supportive pathway to finish their degree and diploma. We will pay for the expenses for their enrollment and class instruction, depending on where that educational assessment places them. We will cover their required books and calculator, and then we'll reimburse their fee to take their GED or the high school equivalency exam. And we know that this is really important because if we're truly going to deliver on equity, we have to look outside of the typical pathways and streams that these program service and covered benefits look at, right? So it's moving beyond a gym membership, right? It's moving beyond a walking program, and it's making sure it's meeting people where they're at and meeting them where they're at in order to elevate them to another level of wellness. And so already we've heard really tremendous responses from our members that they have a job. It's a low wage, low benefits paying job, which is why they are on Medicaid. And they know that if they were to participate in a program like this to finish their high school diploma, they would be eligible to have an increase in their hourly wages. Those are the type of things that make a program like this move beyond health, and it moves the equity needle for education, for employment, for economics as a whole. And so we're really excited to be doing this. And like I said, it's really the first time ever a health plan, commercial or managed care, has done this in the nation. I did a tremendous amount of research, and no one has built a integrated and comprehensive education benefit for their members quite like we have. So I'm really excited to be able to blend my expertise in education with my expertise in healthcare. And then the other ones that are really exciting is our ability to integrate more traditional Native Hawaiian healing and elevate the culture of the people that we serve through these covered value-added services. And so there's 4 that I'll tell you about really briefly. Hula is the first one. And so in this program, what we'll be looking at is to provide opportunities for our members who would like to increase their physical activity and increase their range of motion, their balance, and their flexibility, but through preferred cultural methods. We feel like this is a great way to build a healthy ethnic identity. It's also a great way for us to be supportive to the next step of what has been really tremendous, NIH and CDC funded level research around Hula as an intervention to reduce elevated blood pressure and hypertension. The latest NIH funded research that's been approved for JABSUM, where I graduated from, is actually now looking at cognitive functioning and memory. So we're really excited to be able to provide this benefit. For our members, what this will look like is they'll be able to participate in person or virtually in their Hula classes, and they will have a maximum benefit of 96 sessions per year, which is substantial. That means that they can take about 2 Hula classes per week or about 8 Hula classes per month, totally free of charge. We'll be working with the community health centers and the Native Hawaiian healthcare systems, and they'll be the primary location where the Hula services and sessions will be delivered. So we're really excited. And then we have a pretty amazing cultural advisor. She's one of the highest and esteemed kumuhula in the practice of Hula is Dr. Hokulani Holt. And so she's advising our program and ensuring that we are elevating these practices in a respectful way, and that we're making sure that we're being supportive to this ancient and cultural practice that has really thrived as a wellness strategy for so many individuals, families, and communities. And we look at our role as just being supportive to that and not as a bureaucratic or business barrier. The next of these cultural Native Hawaiian health healing that we're going to be offering to our members is Lomilomi. And so some of you might have received, Lomilomi before. You've maybe been to a spa, and at that spa, they call it Lomilomi. This is much more than just massage. It's actually our ancient form of Native Hawaiian physiotherapy. And this is a full alignment of the mind, body, and spirit. And so while the conditions that are most often referred in the Lomilomi services that we're tracking now are generally around inflammation, pain in the back, for example, nerve damage or tendon issues. That's usually the referral diagnosis. There's so much more that goes into true Lomilomi, where someone can also have an opportunity to have that physical manipulation and do that deep body work that starts to release the tension, the stress, the anxiety, and the trauma in a culturally responsive way. And so we see this a lot, right? We know that trauma is held within certain pressure points within the body. And so Lomilomi is really a beautiful way to be able to work with a practitioner and then appropriately release those tension points. And so we're very excited to be able to start to do this work, because during the pandemic, we've seen a marked increase in the behavioral health diagnosis, especially around anxiety and stress. We've seen much higher rates than we saw previous to the pandemic. And so this is going to be a really important way for us to not only address anxiety and stress, but to also provide a pathway for cultural healing of injury. And injury, I mean, in a broader sense of that word, right? It can be a spiritual injury or an emotional injury. Those triggers can look very different for different people. The third area that we're launching is our opportunity to build up a real positive collective resilience. And these last two value-added services are really more family-based. We believe in the power of individual agency for one's health and wellness, but we also believe in the power of the collective. And so Hooponopono is an important ancient process found not only in Hawaii, but throughout Polynesia, to bring more open dialogue, communication, and discourse within the family unit, and to reestablish peace and harmony, to build up group cohesion and increase conflict resolution. And so, like Lomilomi, this is a cultural pathway for healing of trauma. However, this is a cultural pathway for the healing of trauma, much more focused on behavioral and mental health. And so it uses the entire family unit, right? So it looks at multiple generations in multiple age groups to come around together, sit with a facilitator referred to as a haku ho'oponopono, and you work through these family-based issues and family-based entanglements over multiple sessions. So our benefit is it's covering 15 family-based sessions for the one individual, and then it rolls over to the next individual in the family should they exceed that. So 15 units over the entire year. And those units typically look at about like 2 hours of intensive, what, is largely similar to like family-based mediation or group family therapy. So myself, I have Unikita as a Hooponopono practitioner. I'm really, really excited to be able to offer this because, again, through COVID-19, we've really seen a real spike in violence, abuse, and neglect, especially among women in our communities. And so it's really important that we're not looking strictly at women to come up with all of the solutions for them and their families and their children and the elders, but it's about the family unit coming together and finding these healing pathways of how to move through, but also to face this violence, the abuse and trauma in a spiritual way that allows for a mutual recognition of one's role in that trauma. Then the last program is similar to Hooponopono and it's family-based. When I was doing that SDOH assessment and structural evaluation, the number one area that we saw throughout the pandemic was people's inability to access food. And so we obviously participate as a managed care plan in the emergency food system where we link people to food banks and food pantries. And we've all volunteered during the pandemic at food drives to pass out bags of food and cans of food. We also want to make sure that because Hawaii, we import about 93% of our food, that we start to look more upstream at the entire food system and make sure that those foods that we're connecting our members to are local, organic as much as possible, healthy, and culturally based. It's really, really hard to do a nutrition class, for example, with Medicaid members and talk, sometimes about lettuce or kale, right? Things that maybe some folks didn't grow up with as much. But when you start to talk about watercress, or you talk about ulu, or you talk about bananas, right? Like things that grew in your grandparents' yard, trees that were on the street that you lived in, then you start to make a deeper connection of these ancestral foods being a part of not just nourishing the stomach, but actually nourishing the entire body and the mind and the spirit, so that somebody who wants to think of this much more holistically for long-term behavior change knows that there's these nutritional resources that are culturally based and available to them that are also healthy, right? So we can definitely address added sugars, high fat, um, high sodium types of foods that typically get passed out in food pantries and food banks, much more through these community-based programs that are growing food and that are helping patients learn about the foods that they're consuming, where to buy them, how to prepare them, and then how do you make these recipes that are important for families like those that I serve. We have 9 to 12 people living in a household, often 4 generations in one house, that you can't just make one serving of food, right? It's making a serving for the entire family. So that's a lot of what we'll be doing. This program is entirely unique. We'll be actually providing prepared meals and locally produced food, such as local eggs, poi, so on and so forth, in these food boxes that will be delivered. Members will be able to participate up to 3 meals per day, 3 times per week for 24 weeks for free in this program. And we're working with pretty amazing community health centers, local chefs and cultural practitioners that are really about food sovereignty and changing the entire food system from the bottom up. So kind of what does all of this mean for those of us that work in health and are providers of health care? It's us really looking beyond the clinical return on investment and the financial return on investment. And for me, my job is to really articulate and to quantify a social return on investment, that we know if we can bring these types of culturally responsive services, programs, and benefits to the people that we serve, we have an opportunity to reduce the burden on the healthcare system. We have an opportunity to preserve and pass on cultural practices so that we reinstitute cultural revitalization within families, homes, and communities that ultimately lead to greater, healthier lives and longer attachment and engagement with those types of practices, rather than just a prescription or a short-term 4 to 6 week program. This really fosters connections to a patient's own health, the health of their own families, and then the communities that they live within, because these are really community based and are going to be locally relevant. And so the practitioners and sites that we work with are not flying in from other places. They're right there in their own community. So they'll have access to this care with Aloha that we imagine on a recurring and frequent basis. We're using a new bi-directional service referral tool. It's called Unite Us. We just launched in Hawaii in April, and then we were statewide just about 6 weeks or so ago in mid-October. And already we have more than 266 programs, social service agencies, nonprofits that do a lot of SDOH work. And then our health coordinators, our providers, our community health workers can use this online platform to connect members directly with those needs based off of their own assessment or based off of the assessment of their care team. So we're really excited to be working with Unite Us for the next few years, because we know that oftentimes for those of us that do this work, we're typically burdened by a lot of paperwork, emails, faxes, electronic health records that don't necessarily always capture something like, my patient doesn't have diapers for their baby, or they don't have clothes for their children for back to school. normal, right? These are stressors that are on the minds of the people that we care for, and that we want to make sure that they get linked up to the programs that are doing that type of work, because there are really amazing programs out there that just need greater spotlight and then greater technology to make sure that we support the coordination of those efforts. And so just kind of in summary, hopefully we're demonstrating through this opportunity through Medicaid that culturally responsive care is possible. We're not just randomly and arbitrarily starting programs, covered benefits and services. We're thinking about the entire ecosystem of resources. We're building strong partnerships for collaboration. We're working tirelessly through our advocacy and policy portals to make sure that one day these become Medicaid eligible expenses rather than Aloha Care investments. We are transitioning our own internal knowledge so that folks know that these types of services are in demand and they're of great quality for the communities here in Hawaii. And we're building out data collection, analytics, and reporting like you wouldn't believe. We're going to have tons and tons of data that will be able to follow and track and monitor the members of these programs all the way from their eligibility, their diagnostic codes, the billable codes, all the way through to the impact and the outcomes achieved that can help us I think create real new opportunities for disease prevention and health promotion through community-driven initiatives. So that's a little bit what I wanted to share today. I know it's a lot, but I wanted to be able to just provide you with this opportunity that shows, I think, every one of us, that no matter where we work or how we work, there's an opportunity right now ahead of us to completely rewrite the playbook. None of these programs, services, and covered benefits existed before. This is the first time ever in Medicaid history that these traditional healing services have been approved for Medicaid. And, you folks often ask me, like, well, where did you get this from? Like, how did you copy this? And I just quite easily say, like, I didn't. Like, I've done all of this in 2 years, started out on the back of a napkin of just like what was keeping me up at night towards going through all of the regulatory and compliance process for CMS and the ways in which these types of programs get authorized and funded. And so I'm, probably more than anything, I just wanted to share with folks today is take your big ideas, like, don't give up on them. And I promise you there's a way in which you can find a place for those big ideas to be operationalized and invested in within the places that you work to better support the people that I know you each care so deeply and passionately about for our industry. And I'm really excited for all the work that you folks will be doing ahead. And I'll be your #1 cheerleader as we think about not having to stick with just the status quo. We can really set the new tone and pulse of what health equity looks like and what culturally responsive care can mean across all geographic regions and demographics. I'm happy now to answer any questions, and then I'm also really happy now to just open it up for dialogue if folks have other burning questions or deep thoughts that is coming up for you today as you think about how you want to close out 2021 and how do you want to start 2022 with your big visions. Thanks so much for having me.
Thank you, Dr. Fox, for your wonderful presentation. So yeah, we'll now open the floor to any audience questions.
Yeah, I'm happy to jump in first. Thank you so much, Dr. Fox, for the amazing presentation. It's really, I'm a medical student now, and I think one thing that's been weighing a lot on my mind is the idea that only about 10% of health disparities are actually due to disparities in medical care. And so it's really, really inspiring to see this organization that you've built, which it sort of integrates medical care with many, many other opportunities to address the social determinants of health. And I think I have a number of questions, but just to limit myself to one here, I'm interested to hear a little bit about your experience balancing this sort of Western biomedical idea of health and healthcare with more traditional, culturally sensitive beliefs, especially now in the age of COVID-19. I can say that from my experience treating mostly Chinese immigrant populations here in the city of Chicago, one thing I've run into a lot in the clinic is people saying, well, I'm not going to get the vaccine because I've been using this approach from traditional Chinese medicine instead. And within, my worldview, that's enough and that works. And so it's interesting coming from a center which does a really great job of trying to integrate the two and give equal respect to both sides. How do you also handle that idea? And have you run into that issue of battling misinformation around COVID-19 vaccines, et cetera?
Great question. So I think one of the things for me to start with is, firstly, I have, so I just want to share what my positionality is I have been dual trained, both as a traditional practitioner, as was shared in my bio, and also as a clinician. And I think that this has really helped me not only as a patient advocate and a healthcare executive, but also just as a person who I also receive healthcare myself. I have a young son who needs his own healthcare. When it comes to vaccine hesitancy, I think we've all really had to navigate that uniquely through the populations that we serve, but there are some real overarching themes that a lot of us saw, right? Is one, folks tend to have listened to wise community leaders, thought leaders, whether that's at their school or their church or where they recreate, maybe they're in a like here, our hula hello and our paddling clubs are strong social ties to the community and the families, right? And so we've seen some of the same vaccine hesitancy of, well, I do this traditional medicine. Do I need to also get a vaccination? We always start that the past 20 months has to also be representative of 20 years of health disparities and social inequities, and that those 20 years are also representative of 200 years of rapid pandemic, epidemic, and infectious diseases that have, catastrophically altered our entire community. And so we start with a place of that history, those traditions are valued, and we also know because of that history that our elders, our ancestors, our community leaders have always been supportive of vaccinations, because it wasn't just COVID. Before, it was TB, it was the measles, it was almost every epidemic that you could think of. And that's resonated a lot with the communities that we serve, is because every single person, if you're Native Hawaiian, you can trace your ancestry back to an era where many people in your family would have died. And we have these census records that are really intact to show that, we had children dying and adults dying and elders dying within, the same time period as there were cholera epidemics, right? And so we're using that as a mirror for us to have these really relevant conversations today that our ancestors and our family members would have grappled with at the same time as those other pandemics. And, for us, it's going, a lot of people have compared COVID to the influenza for 1919 and 1920, right? We actually can go back to 1819 and 1820, and we can show really 200 years of history where traditional medicine and culturally responsive care has a place alongside modern technology and biomedicine to make sure that at the lowest level, we just want our people to survive. And we want them to be able to continue to live healthy and long lives, because we have these chronic conditions, which are already, they're well researched and have completely destabilized our population, where now people like Native Hawaiians and Pacific Islanders have lower life expectancies and have, morbidity and mortality rates for chronic diseases, which we completely know how to prevent, right? And it's these systems, it's these structural barriers that, like the food system, like the housing systems, that keep us locked into these cycles of poverty and injustice. So, it's complex and it's not easy. And the way that we break it down most often is by using that history and that culture as a tool for us to look beyond ourselves and look at the greater family unit, because we have found that family values and cultural values are what cuts through like political noise in the media and misinformation, so on and so forth. I think there's some other questions maybe popping up in the chat, but I will ask maybe if somebody can help with the moderating, if there is. Oh, it's just about the recording. I'll let you guys answer about the recording. I'm not the tech person.
So we will send a follow-up email with the recording and we'll make it available. I had a question as your advice or tips on how medical students can dive deeper into learning and integrating Lomilomi, La'alapa'au, or Hooponopono into clinical practice.
I think for me, it's not necessarily only just starting there. I think it's also looking at what are the traditions and the cultural practices that exist in the area that you're serving, or even in your own culture. So people have already come to me and they're like, what if we did Tai Chi? Like, what if we did acupuncture? Like, people already have tons and tons of ideas, right? I will share that I have a lot of hesitancy, because I know that there are commercial health plans that are marketing cultural practices such as yoga and meditation. And I see these as being largely extractive because of a few things. There are hallmark cornerstones of how I know a company is doing it the right way and how they don't. One is who's leading these programs, right? Are you working with trained practitioners, or are you going to Orange Theory? There's a real difference of if your marketing strategy is like Lululemon, or if it's deeply people connecting to the land and the environment and their spirituality. And typically you get that right across the bat. The second is oftentimes through whether it's the health plan or it's a hospital system, what you will also see is the amount of service available to the person is very nominal for the totality of the health that they're trying to impact, right? So oftentimes you will see someone offer a program, and I think I had mentioned this when I was doing the presentation. Oftentimes you'll see somebody try to solve type 2 diabetes in 5 or 6 sessions. Good luck, because we're trying to solve type 2 diabetes across 5 or 6 generations in the community that we serve right now. And those are ways that you can kind of easily see who is doing this the right way and who's authentically representing cultural practices. So I just wanted to start there, because I don't at all, when I do these presentations, I don't at all suggest that Centene and United and Humana and all of these companies start, marketing Orange Theory yoga to people because it's spiritual and it's a mind-body connection. Not at all. When it comes to Native Hawaiian healing, I think the first starting point for me has always got to be the community practitioners who are really the keepers of this knowledge. And it's starting to develop relationships and rapport, just like we would go to, a stats class and learn R. it's important for us to sit in those workshops. If we work in patient-centered medical homes, that's, I used to work in a PCMH in an FQHC. That's some of the best starting places, right? Go to those lunch and learns, go to those brown bags, like authentically engage in the wisdom and the information that's around you and that's being offered through these programs. Start there, because it doesn't mean that you just start like, you got to start at A to get to Z. It doesn't mean we just start randomly at letter K in the middle of the alphabet and we haven't done our homework. Just like we would never enter medical school in like year 3, right? Like you have to follow natural steps in order to get there. And I think I always recommend to anyone, even the executives that I work with, that there's no limit to where you can start. You can start this, you can be 60 years old and you don't even have to be in healthcare if you're interested. There's always workshops, there's always community gatherings, and there's always learning opportunities. Our practitioners are very generous and deeply engage, thoughtfully observe, leave behind more than you take away, and you find your gifts that you can give to them, because I promise you in the end that you'll learn a lot from those practitioners that you might be working alongside with, but you've never been able to connect to because our schedules are busy and our days are really full and our patient panels are really packed. But when you can, seek them out and build an authentic relationship. That's a recommendation I have.
Hi, Dr. Fox. I had a quick question. Thank you so much for your talk. My name is Emily. I'm actually a family physician. So as someone who practices, I think it's amazing how much your managed care organization has made such an impact in the community. And I wish that was available to all patients. So my question for you is, how is Aloha Cares reaching out to other Medicaid organizations or insurance in general to just have this be more of a resource for other individuals? I know you mentioned in the beginning that you were part of the a health organization community of like other programs. And so are you making similar presentations? Have you seen a lot of adoption in terms of doing similar parallel programming across multiple spaces? Because the worst is knowing that this exists and then I can't refer anyone to there because they don't have that insurance.
Yeah, no, great question. So I think eventually, yes, we want to scale these programs and services at the level at which the practitioners in the community seek in demand, right? So we're starting out small and then we're going to grow over time. We have to build that roadmap from a really sturdy foundation because the stakes are incredibly high. We know that people will be looking to find holes and to find inadequacies with doing something outside of the box. And so I'm really mindful of the way that this suite of offerings is being constructed from the very beginning. I do a lot of presentations. I will say last year, I think I did like 75 panels, keynotes, workshops, so on and so forth. We'll see what I get to at the end of this month for this year. But I think it's probably way too many, and I'll be totally honest. It's hard to turn into a position of microphone because it takes me away from the actual work that really needs to be done. And so I try to find a balance as much as possible. And one of the ways that I'm constructing that balance into these programs is in building really robust data systems and platforms that will pull all of the member data with the programmatic data, and it will match with the financial data so that over time, like I showed you the social return on investment, I'm a community faculty member to the Tuck School of Business at Dartmouth College. And so I've built a pretty robust model that allows us to look at the area of risk and reward and the cost benefit that we hope to see for every dollar invested, what the cost efficacy of those expenses will look like. And I think that that's probably eventually what will speak the most to the regulators, such as our state Medicaid office, and then of course the federal CMS, which will be really critical because right now this is just approved through 2026 with a possible 3-year extension for Medicaid. I would love to have that same opportunity for demonstration for Medicare, because we have a lot of elders in our community who I think would also benefit from these programs. And so, yeah, there's quite a lot more work to be done. And I hope that eventually I'm just one microphone of many, probably singing the same song, and hopefully it's a tune that other people decide is catchy and that they want to be a part of.
Yeah, I think that data collection is key. Thank you so much for all that you're doing.
Any other questions? And it doesn't just have to be about value-added services. It can also just be about anything.
How do you find the space to breathe?
Oh, that's a good question. I have a pretty great support system. So one, definitely know who you can go to in your network for support. I think some of you might have been, I don't know, actually, maybe some of you weren't here. I was able to speak to your folks' group last year, and I think that I shared that when I was admitted to JABSOM, I was pregnant, and so when I was at JABSOM, I was one of those students that was literally breast pumping on the ground of one of our science buildings. And I promise you, if you can get through that, and if you can get through your baby with a really, really crazy flu while your dissertation is due, I think you can probably almost survive anything in this world. So I don't know. I just have I have a really amazing support system. I have a really supportive family. I have a really strong calling from my community, and the elders in my community have a lot of trust and faith and energy put into me. And so I just I think about all of the privilege that I had and the ways in which I've been invested in. And when I get tired and when I feel like I just want to give up, and I just like, I don't know, like, can I go do like research on my computer by myself and not have to talk to anyone and just sit and play with my data? Like, there are days that I totally want to do that. I get through that in about 48 hours and then I'm good again. And then I also have really great practices of self-care. So I really hope you folks all have a great self-care regimen. And self-care also needs to be peer care, right? And so I've always had really great cohorts that I have been in my academic programs with, or my training programs with, or my fellowship programs with. Really lean on one another, because nobody knows what you're going through at that time better than your cohort does. And life happens for everyone. Like, be as supportive as you can. Build in peer mentoring early and often, because those are the skills that you will take lifelong into your career. Now I have, there are often times where my staff are going through family issues and loss of loved ones, and they're sick themselves, right? Like, this is all part of our lives. It's not just us working in healthcare, it's a part of the greater system of health. And so, yeah, if you can find ways to care for one another, I think those are lifelong skills and values that bring out the very best leaders that can stand the test of time, because we know many people are deciding not to go into this profession now. We have people deciding to leave this profession now. And I really hope that we can build in much more care and social care strategies into our academics, into our training programs, and into our workplaces much more, so that we can all make sure that we're here 30 years from now, because our people really need us to be, and this industry really needs us to be. And it's not easy. So find a confidant and find peers that you can unwind with and have a good time, even if that means, just being an accountability buddy, that you let somebody take the day off. That's really big for me right now, is just letting somebody take the day off, and I'll cover for them because I know that they'll do the same for me.
Thank you so much.
It is approaching 3 o'clock, but we have time for one more question.
Maybe I'll end with a question to you folks if what's one thing you can do by the end of the week that is care for yourself. And you don't necessarily have to shout it out loud to me, maybe put it into the chat if you want to, or maybe just make it a mental note of, by the end of this week, this is something I'm going to do for my own care. And I would love for that to maybe energize folks to try something new, or try something that maybe you've been putting on the back burner and it's like been sitting on your reminder clock and you keep snoozing and you keep putting it away. And if that's just, you want to read a great book or watch a, movie that came out, maybe it's as simple as that. Yes, cooking's a great one, especially this time of year. I know lots of folks are sharing pictures of what they're making and hopefully offering recipe examples for others to try out. I'm not a great cook, so I always need a good recipe to try, especially the simple ones. Oh, I love that, Jenny. Journaling. I'm an avid journaler myself. I'm an introvert, and so I really thrive off of that time alone. It actually really energizes me. So journaling is definitely a critical self-care tool for myself too. Thanks for sharing. Yay, snow. Yes, Reno is really beautiful. Reno, Tahoe, all those areas, really gorgeous.
Dr. Fox, I just wanted to thank you for your time. I'm a first-year medical student at the University of Nevada, Reno, and it's just really great to hear and see from a Native Hawaiian woman. I don't get to see it very often. I was at the NIH before, and even then I was kind of one person, and I was like, I don't really know any Pacific Islanders or Native Hawaiians here, so it's always good to see and learn from my own culture, and also spreading the awareness to my classmates and my peers.
Thank you so much, Celeste. There's programs. I was an NIH postdoc scholar for minority health disparities. I know there's these amazing programs that exist out there and are meant to make sure that people like both of us, all of us, have a seat at the table. Share those as much as you can with your peers. There are so many incredible scholarship and fellowship and leadership development that's really trying to include many more Asian American, Native Hawaiian, and Pacific Islander representation. And I hope to see much more parity for our peoples and our population in those programs in the future, since I'm, it wasn't uncommon that I would be the only one that would be an NHPI, checkbox in many of those leadership development opportunities that I was given. I hope that it won't be the same very soon here.
Yeah, it's definitely sometimes lonely, but I tried to find stuff whenever I moved to at least feel a little bit more connected, because moving all over the mainland makes it difficult. But I think Reno has like a couple like Hula halaus and like some restaurants. So I'm like trying to find a community, and I know like even the civic clubs are good to reach out to as well. So thank you so much.
Yeah, those are all great starts.
All right. Before we conclude, I was wondering if we could take a quick group picture with our videos on, if that's all right with everyone.
I want to see your smiling faces. Hi, Jordan. Hi, Jenny. Hi, Celeste. Good to see your faces.
All right, 1, 2, 3.
Looks good? All right.
Looks good. If anyone has additional questions for Dr. Fox, please submit them to nhpidirector@apamsa.org. Thank you so much, Dr. Fox, for sharing your time and expertise with us today amidst the weather conditions. It was such an informative and eye-opening presentation. So mahalo. And thank you to everyone for attending our workshop today. Our next National APAMSA event will be with the National Alliance on Mental Illness Long Beach on the importance of cultural mental health care this Wednesday. So thank you, everyone, and enjoy the rest of your Monday.
Thank
Thank
you so
you.
much.
Thank you so much.
Thank you.
Bye.